Welcome to Breath of Change, the podcast where we talk honestly about health, hope, and taking steps towards a better life. I'm Tracey, and today we're diving into a topic that affects millions of people, smoking cessation. Whether you're someone who smokes, you care about someone who does, or you're a healthcare professional helping patients quit, this episode is for you. Let's start with the big question. Why is quitting smoking so important? We know smoking harms health, but what many people don't realize is how quickly the body begins to heal once smoking stops. Within 20 minutes, your heart rate drops. Within 24 hours, your carbon monoxide levels fall back to normal. And long-term, quitting lowers the risk of heart disease, stroke, lung cancer, and improves overall immune function. For cancer patients, quitting is even more crucial. Studies show that patients who continue smoking during treatment face higher rates of complications, more hospitalizations, and reduced responsiveness to therapy. But the good news is, quitting at any stage improves outcomes. So let's be real. Quitting isn't just a physical battle. It's a psychological one, too. Nicotine affects the brain and its reward system, making it incredibly addictive. And then there are other stressors, social influences, and habits like, quote, the morning cigarette, or during a lunch break, smoking during a lunch break or afternoon outing with people. It's not just willpower, it's about the support and planning and the tools for it to work. So here's what we know from research. Combining behavioral support with pharmacological treatment gives patients the best chance of success. So strategies include setting a clear quit date, identifying triggers like stress, alcohol, or certain social settings, replacing smoking with healthier coping skills, deep breathing, brief walks, gum, or mindful pauses. Using these support systems, family, friends, groups, coaching, or counseling may help as well. Some medications that can help, such as nicotine replacement therapy, which includes patches, gum, lozenges, inhalers, medications such as Chantix or Zyban. These medications can help reduce withdrawal, ease some of the cravings, and help retain the brain away from nicotine dependence. But always remember, relapse doesn't mean failure. It just means we have to readjust the plan. Smoking isn't just a personal behavior. It's shaped by social determinants of health, stress from financial strain, lack of access to cessation programs, limited transportation, food insecurities, living in communities where smoking is very common. Understanding that these factors change how we support patients is a big factor. Instead of saying, why don't you just quit? We have to start asking, what's making quitting difficult for you and how can that be helpful? For oncology patients, this is huge because addressing barriers like transportation, nutrition, and mental health improves quit rates and treatment adherence. We want to make sure that you continue to make it to appointments, make sure you continue your treatment plan, But often, it becomes a struggle. So with coming into the oncology clinics, you're seeing nurses more often than other roles in the facility. Nurses often spend the majority of time with patients. We spend most of the time talking to patients. We spend times with counseling matters. And even for us, just having a simple conversations to discuss models of care, such as asking about patients, are you smoking? Are you using tobacco? We have to find out, are you interested in quitting smoking in a personalized way? What's the willingness that you're willing to stop smoking? Providing resources and medications and providing support. So reach out to your staff, your nurses that you're seeing on treatment days or when you're going to the physician's office, if you're interested, or even if you want to have a conversation about stopping smoking. Even brief counseling, less than 3 minutes have been shown to increase quit rates. So as nurses, we have the power to plant that seed, and I feel like people need to reach out to the staff that can help you. If you're listening today and you've tried quitting before, I want you to hear this clearly. You're not alone and you're not failing. Most people try multiple times before they quit for good. Every attempt gets you closer. Your body wants to heal, and support is available. So please talk to your healthcare team, explore apps, quit lines, evidence-based medications, and the best time to quit was yesterday, but the second best is today. Thank you for joining me for this episode of Breathe of Change. If you found this helpful, share it with someone who might need encouragement and support in quitting smoking. Remember, change doesn't happen overnight, but every step towards quitting is a step towards healthier and stronger you. Until next time, keep moving forward. And thank you.